Hello, Nursing 212. Let's get started with Module 1. Let's look at our objectives, which I will not read, but here are our objectives. We have 3 pages of objectives, so make sure you read them. And this is the last one. As we took off onto a fast start, I didn't get a chance to get your introduction of yourself and healthcare background and why you want to be a nurse and your biggest fears about nursing school or any concerns you might have, and what do you do for fun as an icebreaker. So we'll probably touch on this in this on-campus skill so we can get to know each other. I've made a recording of the syllabus, but I want to make sure that you all look at these policies. Very important, because when things happen in nursing school, you will need to fall back on your policy and your student handbook. In your syllabus, it does talk about the critical elements in Study Guide 1.3. These are some of the elements. Now, sepsis. Now, we did go over good hand washing, and we saw how still we had germs left on our fingers, our hands, our wrists, our nail beds. So make sure that you do excellent and good hand washing. Scrub, scrub, scrub. Now, emotional jeopardy, action or inaction, your body language, actions that threatens the emotional wellness of the patient. So monitor yourself. Remember how I said how patients may speak to us one way, but we cannot respond back that way. We don't want our actions to threaten the patient, their physical well-being. Leaving the side rails down, giving medication the wrong way, seeing things on the floor and not picking them up, or seeing water, possible slip and fall. Not repositioning. IV is beeping. We pretended that we didn't hear it going off. Lots of things that could affect the patient's well-being, physical well-being. Let's monitor ourselves, because we definitely don't want to put ourselves in physical. As you look at this slide, I will tell you, just monitor yourself and your caring behavior and how you respond to patients. Okay? It could be nonverbal, verbal, body actions. Just monitor yourself and make sure that you're responding to patients in a caring manner. As we talk about nursing meta paradigm, I spoke on it in class, how the patient is in the middle and all the factors that affect that patient. You can also look at your chapter and read more on the meta paradigm for nursing. I believe that was page 38. So please read it to get your understanding. And like always, come to me with questions, okay? So we have different nursing theorists, and this tree shows we have nursing, we have Florence Nightingale, nurse, the person, health. We also have Watson, we have Rogers, developmental theory, systems theory, interactive theory, Henderson. We have many that we can talk about, and basically they all circle the patient. So as I continue to talk, if you have your syllabus and your book open and flip to your syllabus, you will see in Module 1, it talks about the meta paradigm. And I am in Chapter 3. So you have these things to assist you and guide you in your learning as we continue lecture. This is the meta paradigm on page 38. And you can continue on with the reading as we did earlier. I wanted to make sure that I reinforce that. In your reading, we will talk about person, environment, health, and nursing. And you have a little blurb on each side. The person is your patient. Some facilities call patients clients. It's the one who is receiving the care. The environment, as I talked to you guys earlier, can be internal and external, the things that's going to affect your patient. And a degree of wellness, or wellness being that person experienced. So are they getting better? Are they improving? Are they stagnant in their health? Are they declining in their health? And of course, the attributes and the characteristics and actions of us. We are the nurse. As I showed you the tree earlier, Just pay attention to your nursing theorists and your nursing theories. As I won't spend a lot of time, but I do want you to know about your nursing theories. If you go to page 40 in your book, you have an overview of selected nursing theories. And it starts off with our famous nursing theorist, which is Nightingale's environmental theory. So please read on Nightingale. The most important you see here, she was about cleanliness, our environment. How can we heal and get better in an unclean environment? So that's on page 40. As you advance in your nursing career, make sure you never forget about the American Nursing Association. Okay, I did put the website here. It does work. If you hover over it, it talks to you about the American Nursing Association. Once you graduate, you can become a member. This member dues. And then the American Nurses Association supports nurses and patients. They geared really hard for our nurse-patient ratio. Other issues like our safety, patients trying to make it a law for patients not to hit on nurses, and other things involved. You do have all the nursing department threads in here. So just look at each one. Look at the red ones and how they highlight. Communication, nursing process, safety. What do these look like? Look like our 7 core values. So we do pull out some and we still focus on those. So your 7 core values will be hit at you left and right, because we just want you to know. Okay, so wellness is considered your physical, psychological, spiritual, and your environmental and social well-being. So you can look at those in details if you're unaware of what physical, psychological, or spiritual, environmental, and social well-being is. I want you guys just to look at this and think about the stress that patients go through and how we as nurses can help the patient manage their stress. Nutrition, exercise, time management, education, support groups, social services, the case manager, different things that we can do to assist the patient in managing their stress. Look in chapter 42, that's around page 970s, and look at the models of stress, stimulus-based models, different avenues that you can read on regarding stress. Okay? Stress is a factor that affects your mental stability and your physical stability. So we definitely need to make sure that we look at our patients and see if they're in a stressful mood, mode, or condition, what we as nurses can do to assist them in getting out of that stressful. Maybe sitting and talking with them, explaining, educating, different things that we can do to help. And as you look back at your syllabus, look at this area where Objective 9, where I'm talking about stress. Describe the endocrine system response to stress. Read on that a little bit more. Describe the general adaptation syndrome. List common sources of stress. You see how the objectives are going. I try to have the PowerPoints go with the objectives, which also matches with your chapter. As we talk about psychological wellness, it's based on how the patient is accepting the disease process they have, what's their self-esteem about it, how about the relationship with their significant other, are things going on with them that they can't focus on the healing process, different things for psychological wellness. I want you to read a little bit more in there. And also we have the psychiatric health, that affects patients about post-traumatic stress. Some patients are suicidal. Read a bit on there. You'll be surprised about which gender is at high risk for suicide, what age group, different age groups, the different methods that they use to commit suicide. Okay, and then also you'll know about the most common psychiatric disorders that happens in the hospital. I just wanted to flip back to your syllabus. We're in Module 1. There we go, in Module 1. And you see Chapter 42, Chapter 16. And here we talked about techniques for stress. And here are some defined psychological wellness. I just want to pop back and let you guys know your outline is for your chapters and what you should know. Substance abuse is a big thing. You can have substance abuse emergencies. You can have patients going through alcohol withdrawal. And don't forget about your soccer moms or those people who look perfect. After day 2 or day 3 is when those signs and symptoms of withdrawal occurs. Hallucination, tremors, seizures. They get hyperactive, restlessness. All these things do happen with withdrawals. Okay, so we have to be careful with the substance abuse and alcohol intoxication when patients are experiencing those. Now, for health promotion, I just want you to really focus on primary prevention, secondary detection of disease, tertiary begins after illness, prevention complication. That's what we want to prevent any further complication. And like in other words, you find that you have diabetes, you want to make sure you have foot care. Okay? Prevention is before we even had diabetes, we need to lose weight, exercise, eat good. So this is the health promotion model. Please look at Healthy People 22 on page 248. Very important, is led by government and the hospitals based a lot of things they do on Healthy People 2020. Hi, let's use our last few minutes on body mechanics. I want to make sure that you don't go in this profession and hurt your back. Nursing injuries, back and shoulder injuries are the most common, okay? Make sure the base of your feet are wide. You use equipment to lift patients. Don't try and do this on your own, men or women, okay? 35-pound limit, no other issues. Move your patients, transfer with assistance. Then I want you to also make sure when you do get help on chapter 44, you log roll. So what is log rolling? We will do that in the skills lab. RN can show you there. Definitely your clinical instructors can show you in the clinical setting. Okay, moving up in bed, turning, all the safe ways. Safe patient handling is very important. Okay, we did go over some positions in class, supine, prone, and Fowler. I don't think we went over prone. Prone is flat. Read that in your chapter 44. Okay? Flat, lying down flat, like face forward. dangling when your legs just hang off the chair. They can go swing forward, back and forth. And transfers. I want to make sure we touched on immobility and being safe for yourself. We did talk a little bit about the nursing process. That's why I didn't go over those slides, and we would do that throughout the nursing program. So don't worry about that. We will touch on those one by one. And death and dying, we'll touch on that later on in the nursing.